Abigail, you related to Larry?
Yes.
All right, that's what I thought. We've met before, and yeah. Anyway, you're first.
How weird, you're so unrelated.
Thank you so much, Chairman Simpson and members of the committee, for having me. My name is Abigail Echo-Hawk. I'm a citizen of the Pawnee Nation of Oklahoma, and I serve as the Executive Vice President of the Seattle Indian Health Board. You just heard from my boss, the incredible Esther Lucero, where I direct all of our public health work, specifically our Tribal Epidemiology Center, the Urban Indian Health Institute, and I am here to speak to you about the work of our Tribal Epidemiology Center today. This week, or last week, May 5th, was National Remembrance Day on Missing and Murdered Indigenous Women and Girls. And it is one that our organization has been leading on. The Urban Indian Health Institute continues to be the national leader on research and data and interventions related to missing and murdered Indigenous women and girls. I spent that last week with young people in the state of Washington and across the country, where I realized as I sat in rooms with young women, Native women, that the number one thing that they are advocating for, as we think about folks who do high school projects, that are working in their colleges, who are researching and thinking about impact in their communities, is a majority of them are advocating on missing and murdered Indigenous women and girls and people. I sit with young people who the number one thing they're advocating for is to ensure that they don't get murdered. This is a reality that exists not only for the urban communities, but across our tribal communities. And so in 2018, the Urban Indian Health Institute released the very first data report on missing and murdered Indigenous women and girls, where we looked at the impact in 71 cities across the United States. That report was used and catalyzed to both ensure that Savannah's Act, which at the time, in the iteration in which it had been written, would not affect urban-dwelling American Indians and Alaska Natives. It was used to ensure that urban Indians were included in that legislation. Within that legislation, the Department of Justice is to provide resources to not only the urban Indian people, but also urban law enforcement to ensure that they are appropriately addressing this crisis. And yet, last week, as I sat with advocates, I sat with family members, we wept more than we cried. We grieved more than we had seen any kind of justice. We recognize that the Department of Justice has completely failed to give those resources to urban Indian communities. So when we talk about the opiate crisis, homelessness, the high rates of suicidality, we are battling a crisis of trauma in Indian country. And until we address the root causes, we're going to sit here and continue to talk about how to combat the high rates of opiates and fentanyl. And yet, that is not what is happening. So urban Indian programs like the Seattle Indian Health Board and those across the nation, along with tribal communities, we are utilizing our IHS dollars, which are so essential, which is why we need advanced appropriations at the full funding levels of the Indian Health Service, because we are helping those family members who walk in our doors who have a loved one that's gone missing. I work with communities, for example, right now with a family where the mother, who has been in a long-term domestic violence relationship, had been impregnated, had 12 children before the age of 40, had suffered so much traumatic head injury that she was suffering from dementia. And yet our IHS dementia dollars are for folks who are elders, not for those who have been suffering traumatic brain injury as a result of the domestic violence that they are experiencing. And then that abuser, somebody not from our communities, was using her dementia as a way to not only keep her, because he would then say he would keep her children because she wouldn't be seen as cognitively fit to keep them. That is the crisis that we're talking about, and yet the Department of Justice has not stepped up. Recently, in Washington, a family from the state of Alaska reached out because we had seen a murder of their loved one 5 months before, and yet the police department had never reached out to that family, had not assigned an investigator, and nor did they do so until the tribe reached out to the Urban Indian Health Institute, where we advocated for and were able to get that police department to appropriately invest and to work in a culturally competent way with that family. We're doing the work that the Department of Justice is supposed to be doing, and we will continue to do it, but I'm furious about it. And we continue to see folks walk in our doors who require, and we want to provide those traditional Indian medicine services that actually impact them, that actually show them that they are cared for and that our culture, we know, is what will lead us into healing. But until we can undo that underlying trauma, we're just going to be treating the symptoms. As a survivor of sexual violence myself, that happened on and off tribal lands. And yet we saw, in my instance, more than 20 years ago, where law enforcement refused to do anything because I was just an Indian girl, and that's actually what they told my dad. And then that person went on to abuse and rape more than 20 other people aside from myself. This maze of injustice that we all battle isn't something that is so far off that we just celebrate on May 5th and remember. May 5th for me was a time for action. And until we have full funding for the Indian Health Service, where our tribal epidemiology centers like the Urban Indian Health Institute finally have the resources and funding, we're going to be battling those symptoms. I don't want to keep sitting in rooms of young women who talk about what happened when they are going to get raped because they see it as an inevitability. Instead, I want to sit in rooms where we know that we are moving forward into healing, and I invite all of you to take that step forward with us, which means that we have to have full funding for the Indian healthcare system. We need to see a hearing related to missing and murdered Indigenous women and girls, and we have to ensure that urban Indians are included because we have been excluded in that up until this point. We need accountability, we need resources, and we need to ensure that our right as tribal nations for public safety, as is within the treaty and trust responsibility, is upheld. And until then, I'm going to keep showing up here angry, but I'm going to keep offering the resources and the ways for us to move forward. So thank you for having me here today. And again, I invite you, move forward with us in ensuring that this crisis doesn't continue.
Thank you, Abigail. Ed?